Save My Piggies, Your Life, Your Limb, Your Story, with host Dr. John Phillips and Kim McNicholas.
We are talking to Felicia. She is Gary's mom. Gary transitioned earlier this week after a long battle with multiple comorbidities, including some valvular disease in his heart, some coronary artery disease, diabetes, chronic kidney failure, as well as peripheral vascular disease. And he fought a very long, hard, inspiring, though, battle. He certainly had such a zest for life, and he had so much fight in him that it inspired all of us to just keep fighting alongside he and his mom, even his doctor, Dr. Athar Ansari. But I want to get to Felicia to start us off. So, Gary was a diabetic, diagnosed when he was about 11 or 12. He went off to college. He continued to treat himself. But it was after college, he had some insurance troubles and things like that.
No college. He couldn't go to college. He was
Couldn't go to college.
Yeah, he didn't go to college. He just thought that he needed to live his life. And he was a comedian. He was an artist. He was just a...
Felicia, real quick, since we're talking about Gary, he's a comedian, right? So what was his best joke?
Oh, his best joke. Oh, my gosh. There's so many. He would always just mess with you.
Okay.
He would just mess with you. And then it would be in the moment. I always used to tell him, you need to go down to Fifth Avenue and go on the nights they have the open mic. He said, Mom, I can't do it like that. I have to be around people and joking. So I just can't think of one right now.
Right, well, obviously he's a very special guy. Sorry to interrupt.
He is. He's a very creative person. He created a lot of art, and I was telling my other son, he's gonna have to come in, get all of his artwork and display it, and let his friends, take whatever they want from it, because it's so much. I mean, he's got T-shirts, he's got cups, he's got glasses, he's got trays, he's got it's just so much stuff. And I would find his art in the middle of a tablet. I would say, okay, the tablet looks clean, and I'd run through it, and then there's an art he had drawn. Yeah. So, and
did his art reflect his zest for life and his fight?
Well, yeah, I would say so, because he would have his biggest art one was he had this nice face on one side, and this other side was like it was cut away, and it was like mechanical. It was like he had two different people that he was dealing with. This guy who was healthy and well, and this other guy who was broken. Yeah. And he'd always say, I was broken since I was born. He was born breech. He was born breech. He had to wear a harness. Nobody could really hold him unless you held him right, because his hips were dislocated. He had a foot that was long, a leg that was longer than the other. He never let all those things stop him from exploring, doing whatever he wanted. He wanted to drive. He wanted a car. He wanted to be married. He wanted to have children. He never got those opportunities.
Yeah, but I mean, so he obviously got dealt a pretty crappy hand, but you can do one of two things. You can fold and quit, or keep playing it. And he kept playing his hand, it sounds like. So,
yeah, he did. Clear up until, and this is where, just recently, what was it, like 6 months ago or so, Dr. Athar Ansari had, fixed up his leg. He had gone in, he had performed an angiogram. He is just an angel here on this earth, seriously. Yeah. And he ended up also performing an angiogram on him to clear out some coronary artery blockages, and then discovered that there was something grander in which he needed some open heart surgery. Correct, Dr. Ansari?
Yes. Yeah, he had a very calcified mitral valve and was very, very tight.
And so what happened from, when he went in, how did it transpire to the point where I want to get to the point where they were telling Felicia that they needed to take him off of the ventilator? What did he have done, and where did it go wrong?
It went wrong for me is he has a host of doctors. And when they wanted to cut his legs off, I was like, okay, enough. The doctors that we have aren't telling us anything. They just wanted to cut his leg off, but they wouldn't say, well, it's better if we cut it off here because of blood flow or whatever. And I remember when we started dialysis, in the dialysis room, there was a guy saving limbs. I couldn't find him, but he was saving feet, he was saving limbs, and I couldn't find him. You didn't have to cut his toes off. They never told us why they wanted to cut his toes, all the toes off. No, the doctor said it's balance. Oh, it's diabetes. But they could have saved them before it got as bad, because Gary just had a blister on his toe. So going forward, when they found out he had a mitral valve issue, we went and talked to Dr. Berendaria, and he said, his chances were slim, but he was going to give it a fight. And Gary was, I'm ready to go. I'm ready to do this. Let's just do this. We're gonna be good. He said, yeah, if I got 2%, I'm gonna take the 2%. If I got 5%, I'm gonna take the 5%. But the whole point of Gary's life was just decisions of doctors who never went any further. Never went any further. When I met Dr. Ansari, I never met a doctor who cared enough to do the work necessary to save. You know what I mean? To save his legs. His legs were important. One thing to lose the toes. Okay, I lose the toes, but if I lose my legs, now we're in a whole nother bracket.
Felicia, what happened when they told you to switch the machine off? Because obviously we asked you to get in touch.
They called us and said that Gary's heart, his blood pressure dropped. And they were doing everything they can to keep him alive. And so they said they got his blood pressure level, they got him back up and got a heart rate, but they had tubes going into his heart, going into his lungs, 3 of them. And those tubes only circulated blood from his heart to his lungs and his brain, just this quadrant. Didn't go down the legs, did not go to the arms. Gary did not have any lung issues before going in and get his heart rate. I checked that because the week prior, we had to, for Dr. Ansari to do the angiogram and check him, we had to go and get a x-ray of his lungs. There was absolutely nothing wrong with his lungs. When he came out of surgery, he had 2 holes in his lungs and fluid. And they tried.
Sorry, what was this? What was the surgery that he had?
Triple bypass.
Okay, so he went.
Yeah. And he was on the ECMO. He was on another machine, the breathing machine. He had all that going for, I say, probably a month or more. And when he started getting better, and they took him off of all of that stuff, and they turned him over, the bed sore was big as your lamp head.
Yeah, because they had never turned him over or done any care.
It was black, and it just had like a ring. And the, I don't know what kind of nurse she was. She said, that's not good. I said, what do you mean? He is dark-skinned. No, it was dead skin. So they called the surgeon in. The surgeon removed all the dark skin and the tissue and left a gaping hole all the way up to his spine.
Gosh. Yeah, I saw a picture of that. I couldn't believe it.
It was horrific. And I couldn't understand, like, what was their thought behind all of it.
Because there was no blood. They were trying to keep his heart and his lungs and his brain alive, but there was absolutely no blood flow to the rest of him.
Mm-hmm.
Right.
So the tissue started to die. Yeah. And he got the pressure sore in his sacrum, and he lost both heels. And some of his toes started snapping, autolytically amputating.
Right.
And they weren't looking after his skin. I know you did a beautiful job afterwards with the coconut oil, and his skin was shining and bright. But at that point, they weren't looking after him. And that's when we asked you to phone Dr. Ansari.
Well, that's where I was like, excuse my French, Dr. Ansari, WTF? What? I don't understand. And that's where he was like, yeah, not on my watch.
I don't understand that. That was egregious.
Because his chest was open, they couldn't turn him, but they should have had him on a special bed that could turn him without moving him.
I went to Dr. Ansari and I said, what's going on, Dr. Ansari? And then he wasn't involved intimately at that point in his care, but why did you get involved and what did you do, Dr. Ansari?
So I don't want to take any credit, Kim. I think, as you mentioned, I was not involved. But when I heard that they're going to take off the ventilator, I called the surgeon and I says, no way. And the Baradarian is an outstanding surgeon. And he initially, he agreed with me. And finally, we were set him up. He said that his source can be taken care of as an ambulatory outpatient center, and that's what we
Right, he had
started.
bed sores on his back.
Yeah, so that's what we arranged for that. So we didn't. I think they listened to me, and I blasted them up. I said, I don't want to. I said, we have worked so hard, and until you have totally given up, and eventually we were right that he was taken off the ventilator and he was breathing on his own. And what transpired later on was very, very unfortunate, because I was hoping to just have a party with him and celebrate all this thing. But as you know, in real life, sometimes we don't get all the necessary answers we did. But all I can tell you is his surgery was a miracle. He did a very good job on his surgery. His valves are the most calcified valves he talked to me ever. He ever done one. So he was able to take care of that. He went on ECMO and had multiple other problems, but Gary was a fighter and he was able to get away with all that. And eventually he was get off the ventilator. He was breathing. So, but that's the point. So I think the lesson learned is never give up. And you have it. Maybe we were a little bit unlucky towards the end, and we lost Gary. And I don't know exactly what happened because I was not involved. But the bottom line is, just this routine way of saying wash your hands off and walk away. I personally, I don't like that approach. I think every human life is very valuable, and we need to give us all whatever we have, consult other people, get the best possible we can. I think that's all I can say.
Yes, thank you, Dr. Ansari. And Felicia, one of the things that I noticed, and I don't say this very often, even though I know it's out there, and it was one of the catalysts for me doing what I'm doing, because I experienced in a Louisiana hospital firsthand what I believe was true discrimination when a doctor told me that he was going to go ahead and amputate this man's leg because he was a poor man from the, poor Black man from the projects who wouldn't quit smoking, couldn't comply with doctor's orders to eat better. And so why delay the inevitable? And in following Gary's journey and being with him from a certain point, and in hearing his trials and tribulations throughout, it was something that came to mind. And I'm curious, just from your perspective, as much as I hate to say this, there is a reality out there to it.
There was a lot. If I had to get all of his records from the time, you can see them. Why wouldn't they tell Gary his kidneys were going bad? Why did they wait? He was going to the doctor every month. Why did they not tell us that, okay, his creatinines are lowering? Nothing. Why did the heart doctor see his heart and say, oh, he's fine? What? I'm like, are you serious? He's fine. Dr. Ansari gets this. I'm like, how does he go from being okay to this?
Yeah.
I mean, I'm just, I mean, we had doctor because it's Medicare. The doctor was saying prejudice things while we were there. And me and Gary looked at each other. It's like, okay, we're not coming back here. And they wanted
were there things that were said? Were there things that were said? Can you share those with us? I think it's really important for people to hear this because it is a reality that I even experienced.
It's because they don't want to get paid by Medi-Cal or Medicare. They weren't going to pay him on time. And it's like, I saw you guys have is Medicare. I'm like, well, that's the medical insurance we have. What is it that you're wanting? If he needs to pay for something, we'll pay for it. No, that's what all you guys have anyway. So I was like, what? What? And he didn't do anything for us. He wasted all that time. He's sure they bill Medicare, but they didn't do anything. We would come back and forth, back to back, weeks and weeks and weeks, nothing happening. But I'm sure Medicare paying them for services and nothing was ever done.
So I'm curious, what kept you going back to the same doctor?
Just not knowing. I'm like, it's like, okay, what doctors do we have access to? So I got to change doctors. You can only change doctors certain time. And then this doctor if he was doing a little bit, we didn't want to get off track on the things that we're doing. And then I tell you, I didn't really get the hold of how doctors are supposed to behave towards you. My doctors are different because I was under a medical plan. He wasn't under a medical plan. He was a medi. So it was like, I know I had doctors that I could not go to the doctor that I wanted to because I had a right. But then it was like at Medicare only has certain doctors you could see, certain doctors that would take Medicare.
I think it was Medi-Cal, right?
Medi-Cal, certain doctors took it and some didn't. And when they took it, they milked it.
Yeah.
They make it seem like they're doing something and we're going to do this and we'll see you back in 2 weeks. You come back in 2 weeks, they look at you, they examine you, they hit your heart, they look in his ear. He looks pretty good. Never. All the blood tests he's taken, all the doctors we've gone to, they just, I can't tell you, it's a robbery. They robbed his life because one doctor told us they can't see us anymore because he doesn't want to take Medicare anymore.
Oh God.
And I'm like, that was for his eyes.
Yeah.
We went in for an appointment. He said, I'm not going to be able to see you anymore.
Yeah.
And it was a lot of it during the last few years. It was during Obama. When Obama became president, it was the worst with the doctor and the so-called Obamacare. That was the worst. They didn't want anything to do with it. They had to change all my doctors. They didn't want to be on that plan. They didn't want to take it. Then I take one doctor that was watching his feet. We missed the appointment. He charges $75 or we can't come back.
Are you joking?
No, we could not go back.
I wanted to ask you, Kay, because as we talked about, people can listen to what Felicia's saying as from the patient's perspective and the mom's perspective and the caregiver's perspective and the advocate's perspective. And, that's even with me as an additional advocate for both Felicia and Gary, that something was not quite right in the care he was receiving. There was some sort of discrimination that was happening for whatever reason that it was happening. But coming from your perspective, you have more than 40 years experience in cardiac health as a nurse practitioner. And when I got you involved, the first thing when we had that first conversation after you talked to Felicia and Gary, you said, this man is not even getting standard of care. Would you mind explaining that?
There's a basic standard of care that everybody should be entitled to, and that's to look after somebody. It should be holistic. They should have been looking after him from the tip of his head to the bottom of his toes. They never caught his caliphylaxis in time. They were so late in giving him his treatment for his CKD. They didn't cotton on that it was going to affect his vascular system. They didn't cotton on that it was going to, they weren't interested that it was going to affect his heart.
It was.
When they had him in ICU and he was on echo, and they should have had him on a special bed. And that bed would have been able to alter position every 2 hours without disturbing the fact that Gary's chest was still open. That's basic standard of ICU care to protect his pressure areas. And I have never seen a pressure sore like that for about 30 years, what Gary had on his sacrum.
Diabetic.
And
He was on
he was diabetic. He had kidney failure. It should have been automatic that they looked after his pressure areas. And that is basic nursing care. And Gary was not given it. And the most horrendous part of all of it, there's Gary. I love that picture because his eyes are twinkling. And if anybody's still watching, that man was amazing. And he still is. And he'll stay in my heart for the rest of my days, Felicia. But 100% from his coronary operation until he passed, he was fighting, regardless of the lack of care, regardless of everything he'd been through, he was fighting to stay alive. And it was unfortunately that there was a buildup of fluid, probably from his kidney dialysis. There was a buildup of fluid and it went to his lungs, it went to his legs, and then it went to his heart. And that's probably why Gary passed, because he passed with the fluid compressing his heart.
You were so right, though. He didn't get the level of care that he deserved.
No, he didn't.
Because of our system and the care of people in their jobs. It's not they didn't take the job to care for people. They took the job for a job.
Yes, I agree.
And I had to be there every day because they didn't wash him. They didn't clean him. They didn't take care of his eyes. I had
his legs. I seen you had to put the cream in his legs.
One eye, please. Make sure you're putting drops in his eyes. I don't want him to lose his eye. You know, all kinds of things. The nurses were leaving little things under his bed. They know they could cause him to have more bed sores, but they would drop all these things and wouldn't take, it's like, it was just so many things. I mean, he was an advocate. Even in dialysis, they did not, why didn't they know that things were happening in dialysis? Of
course they knew. They just wanted to ignore it because it meant more surgery and more expense, Felicia.
The foot doctor saw the little bitty blister and just said, well, he's got this. We're just going to let it do what it does. I'm like, what does that mean? Let it die. It's dying. So we didn't know that. I just kept searching and searching. I'm like, why would he let these toes die?
Yeah.
It's a little blister. Why couldn't he clean it out? Do whatever. Right. Nothing.
Felicia, tell me something. Nothing. I know you went the day before he died, and I know you were with him. Tell me something beautiful that you discussed that day.
Well, our whole family was there on Sunday. My brother, my sister, we were talking about the Padres and the Chargers. They're Charger fans, and we were separating ourselves from the Charger fans and the non-Charger fans. And he was just like woo 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 Chargers and doing all that stuff, but we had no inkling that anything was going on. He ate his breakfast, he ate his lunch. I fed him his dinner, which he ate part of his sandwich, and then he would order his food every morning, and I kept saying, why are you guys not getting fluid off for weeks? This is not acceptable. His legs are still swollen. But nobody, and I told the doctor, nobody's communicating to me what's going on. What is going on with the fluid? Why are you guys doing dialysis every day where we're trying to get the fluid off? But nothing else. Yeah. Nothing else.
Okay, what is the standard of care with that that you feel went awry that they should have been doing, and that other people can learn from this and advocate for themselves?
When you got a problem like you're diabetic and you're supposed to pay attention to these things, because I'm a diabetic, my husband's a diabetic. Our doctors are saying, got a checklist. Okay, at this time we're going to make sure all these things are well. They didn't do that with Gary.
Yeah, he should have been not only on dialysis, but they should have been balancing his potassium and his sodium. They should have been making sure that he was on a certain amount of water tablets so that he didn't retain excess water. That should have been put into his IV every single night. There is so much that could have been done.
Yes.
Okay, why doesn't this get done? Is this the first time you've seen anything like this, or is this something that you see often? And if so, why does it happen? How can we prevent it from happening? How can we as patients understand what should be done?
Yes.
Kim, I'm going to put I'm just going to put it out there. I have seen it once or twice. And once or twice when I've seen it, it's because they've gave up on that patient and they've just decided that enough is enough. And they don't give them the care that they should be receiving. And no matter how much Gary or his mum continued to fight, the medical staff or the nursing staff had decided that enough was enough. He'd been in hospital since May. And when the fluid started to build, they knew the protocol, they knew the things that should have been done, and they didn't do it. And in not doing it, they decided Gary's fate.
So, it's interesting that you, in the way that you say that, because a question that we could probably, as patients, ask is, what is standard protocol? Not necessarily the protocol you are going to choose in Gary's situation right now, but I need to know that if you had a normal patient that you thought was going to live forever, that they just had this going on, what would be your standard protocol? Now, looking at Gary, how is your protocol changing for him? Or why are you not doing that protocol? Yeah. And then I, as the patient, can say, wow, I know what should be done. I'm going to choose this to still be done, even if you don't think that this person's going to be worthwhile or live long enough to worry about. At least for me as the patient or the caregiver, the advocate, I can make the determination what is best for me, what is best for my loved one, myself.
But I bet Felicia was never even told about any standard protocols.
No, never.
Never.
Felicia, is that something, based on your experience, because we went through a lot and you started really advocating for his feet. And we talked a lot about what should be done in this situation normally.
Clothes off. He had a history. He was up to he said, I've cut 800 feet already this year. And I'm thinking,
that's nothing to be proud of.
No, this is your goal. And me and Gary are shocked. Just like, his goal is to get to this place. Like, I want to be established as a doctor who can amputate feet. I have amputated 800 feet. So therefore I'm qualified to do this. That was my thinking of what his thoughts were, because he didn't have to amputate Gary's feet.
No, they should have been treated earlier.
Nothing. All he told us to do, betadine, 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 betadine.
Which dries the feet out and makes the toes snap off.
Even for being at dialysis, the standard of care for a dialysis patient, Gary fought inside of there with the doctors, with the staff, with the management. Things were not done right.
Yeah.
He would come home so weak. And it's like, why did they take off 5 kilos? What for?
Yeah. Felicia, you and I both know that there was, I will put the word out there, discrimination here. And it was pretty obvious there was discrimination in Gary's care.
Gary didn't want to die. He didn't want to die.
I know he didn't.
Weeks before that and said, Mom, I don't want to die. I don't want to die. I said, baby, you're not going to die. We have a lot of things to get through, but we're not going to die. And I comforted him, and he got back on track, and he said, I want to get out of this place. Yeah. And I knew that being in those places, you have to watch everything, because these two nurses might be the good nurses. They clean them well. They take care of them. Another two nurses, I got too many people to take care of today. I can't do this. He would lay in his own poop for 2 hours.
Oh dear God.
And I was like, that is unacceptable.
Yeah, it is unacceptable.
To be in your own poop. I have changed them myself.
Yes.
I said, I'm not going to let you lay here because they don't have time. They have too many patients to come and clean you.
Yeah. I would have done the same thing, Felicia.
Also bed sores to leave that in there.
They, it's so...
Felicia, when you're at his funeral, there will be a big bunch of roses there. Roses are the color of red for the way to my heart. And if it could be placed beside where he's going to be interred, and every person that walks past him, if they could take a rose and throw it in on top of Gary in honor of his struggle and the fight that he put up and his zest for life, and from my heart and mostly from Kim's heart, we want everybody there to take part in honoring Gary's life.
Yes.
Because he is the way to our hearts.
He is the way to our hearts.
The way to our
He
hearts.
was like that every day, smiling and sitting up and
Well, see,
talking.
when you take your rose, kiss it for me and give it a
And me
special
too.
kiss from Kim before you throw it in.
He wasn't supposed to die.
No, he wasn't, darling.
No.
And please be brave and know that as far as I'm concerned, you did everything you possibly could and your hands were tied.
Yeah, I told the doctor, I said, you guys have a problem. And that problem is communication between nurses, between shifts, between doctors. And I can't get a hold of you. No one's explaining to me. Nobody's talking to me. Nobody's telling me anything. He said, well, they can call me. I said, you need to fix the things that are going wrong in your hospital.
Yeah. Felicia, my heart is breaking for you. But thank you so much for sharing your story today. And because of today, that video and that picture will never be forgotten.
No, he's with us forever, and we want his, these lessons to go on. I wish it never happened. I know that in our healthcare system, there are a lot of really loving people.
Yes,
I know that there's no one that, really intentionally tries to hurt anyone, but
yes.
I think that there's a lot of room for improvement, especially to honor Gary and to honor you and to honor your fight, and to ensure that at the very least, that there is the basic standard of care provided, and providing every single patient with that dignity in dying, or even more, dignity in living till the moment they die.
Yes.
And I think that that's the way I prefer to look at it, is dignity in living.
Yes.
Your final thoughts and your final lessons. We have about a minute left.
Don't give up. Find another doctor. Search. Like I did. I got on my computer and I just went for it. I know there's somebody out there that cares, and I know there's somebody else out there that wants to make sure this person lives. And we wasn't taking no other answer. We were going to find someone. I knew there was someone out there that was going to help Gary, and they did. Happy. He was ecstatic. We had hot. He was ecstatic. First thing he had was steak when he got off the ventilator.
Did he tell you a joke?
He called.
Did he tell you a joke?
Yeah, he called everybody and thanked everybody.
He did, yeah.
Of calling everybody and thanking everybody who supported him.
A few shows back, Felicia, we had on a member from the Gleason Foundation. Steve Gleason has ALS, and his motto is "No white flags." And my theory is, as long as the patient's fighting, I'm going to fight for him too. So no white flags. And Gary certainly did not raise a white flag at all. So
this show,
thank you so much, everyone.
In tribute to Gary. Thank you, Felicia.
Yeah, tribute to Gary.
yeah,
God bless his soul.
Thank you, everyone.
God bless his soul.